Thank you. Today we have with us Dr. AMANDEEP Kaur, MD, MBA, PhD scholar, Assistant Professor, Department of Pathology and Microbiology, Homeopathy Medical College and Hospital, Sector 26, Chandigarh, India. BHMS from Punjab University, Chandigarh, MD in Materia Medica, MBA from Manipal University, currently pursuing PhD Organ of Medicine from Homeopathy University, Jaipur. Done certificate courses on epidemics, dynamics of infectious diseases from Penn State University, USA. Global Health and Interdisciplinary Overview course by University de Geneva. Training from IGOT Diksha portal regarding COVID care prevention and management. She has published many articles nationally and internationally. To my credit, an avid social worker believes in giving back to society. And the topic is paper presentation on an observational study to analyze the changes in mental and physical status of non-COVID persons developed due to COVID-19 pandemic and lockdown. It's quite interesting. On behalf of IFPH, I welcome Dr. Amandeep. You can have the platform for the next 45 minutes. It's over to you. Please proceed.
A very good evening to all the learned personalities present over here. And this is indeed my pleasure being here for the second time. And I really thank the IFPH talks for giving me this opportunity again. So this time I have come up with a paper presentation on an observational study to analyze the changes in mental and physical status of non-COVID persons developed due to COVID-19 pandemic and lockdown. So this was an observational survey and it was done by Professor Dr. Neeta Bakka, Dr. Amandeep Kaur and Dr. Balakrishnan Nair. So the title of this research was to study the changes in the mental and physical status of non-COVID persons that have developed due to COVID-19 pandemic and in lockdown. So we were seeing there were a lot of care was given and focus was given to the COVID patients, but we wanted to see what are the changes in the persons who are not having any COVID infection, but they are developing some whether they are developing some symptoms or not. We just wanted to see that. So the research question was, does non-COVID persons, those persons who have not infected by COVID-19 infection, does these non-COVID persons have any effect on the mental and physical sphere? Just a second. Yeah, due to COVID-19 pandemic and in lockdown period. So null hypothesis was that there is no change in the mental and physical sphere during that period. An alternate hypothesis was there are changes in mental and physical status. Yeah. So obviously the aim, I have already told that I wanted to study the changes in the people who are not infected with COVID-19 and what are the changes in mental sphere and physical sphere. So we wanted to explore the changes and we wanted to select a preventive medicine for non-COVID persons. So as we all know, the COVID-19 pandemic, they had a severe impact on everybody, whether they were infected or they were not infected by the COVID. So mental health and well-being of people around the world was affected. Few individuals, they got adapted to the situations. Few experienced mental health problems. So at that time, this research was taken way back in 2020 and 2021. So at that time, there was a lot of focus on the people who were contracted the infection, which was also necessary, but there were a lot of changes and impact on people who were not having COVID infection. So at that time, there were 3 periods of COVID-19 restrictions, lockdowns, 3 times there were there, and strict restrictions were there in 2020. But government did not update official guidance and policy between October 20, when the last restriction from the first wave was relaxed, and March 2021, when the second wave of the pandemic was taking off in few states. So there was a lot of confusion between the government and the public, that how to educate the people to not to get the infection, and what should be the policies. So in government scenario, there were a lot of guidelines the government was giving on social media to educate the public from time to time. And meanwhile, they have also launched National Mental Health Program in 1982, and there was one national mental health policy which was introduced in 2014, and a right-based mental health care act in 2017, which was replaced the Mental Health Care Act of 1987. So government was doing every bit to control the infection, but still there was poor implementation on mental health services. There was a treatment gap for mental disorders and poor evidence-based treatment and gender differentials in treatment. There was a shortage of mental health personnel in India, that is 2 mental health workers and zero point 0.3 psychiatrists per 100,000 people population, which is much lower than the global average. And you must have remembered that there was discrimination also. Those people who were getting infection, there was notified it, that house was got notified, and a paper was pasted on their gates that this house is infected with COVID-19. So there was lot of stigma on that also. There was paucity of knowledge of mental disorders, and stigma was also attached with that. So if we see the Ayush protocol, their emphasis were mostly on Ayurvedic medicines and yoga, and there was no protocol related to mental health at that time. So they recommended ashwagandha, chavanprash, rasayan churn for the prevention of post-COVID complications in mental health, but nothing specific to the mental health disorders. Yoga was also advised, and arsenic album 30 was advised as preventive medicine for corona infection. So we wanted to focus on non-COVID persons. As the scope of homeopathic treatment expands in preventing and treating SARS-CoV-2 infection, this was a cross-sectional study that takes the first step toward this less explored area of mental health in lockdown. We wanted to see, were there any changes in people when there was a lockdown? And according to WHO, health is a state of complete physical and mental and social well-being, and not merely absence of disease. This we all know. Hai. So we wanted to see that is there any development of anxiety, fear, worry, or happiness, or increase or decrease of appetite, etc. And questions were also based on events covered by media, like migrant laborers going home barefoot, people losing their jobs, financial crisis, emotional abuse. These were all the major issues which were coming at that time. If you can recall the events, the migrant laborers used to go on barefoot and covering so many kilometers just to get their home, and people were losing jobs, and there were a lot of emotional abuse also, because all the family members are there in the house at one time, and a lot of emotional abuses and physical abuses were also reported in India. So Dr. Honeyman has also experimented himself with cinchona bark, and after experimenting, he could say that cinchona was able to cure the malaria because it was capable of producing the symptoms. Even Hippocrates and Aristotle has said the same thing, that Hippocrates said, by similar things, a disease is produced, and through the application of the like is cured. Aristotle also wrote, often the simile acts upon the simile. So on the same principle, we wanted to see if there are any changes in the mental and physical sphere of non-COVID persons. We wanted to change them to the rubrics, and we wanted to repertorize them to what medicine we can get. So inclusion criteria was age group between 18 to 80, and exclusion was people having known mental conditions and below 18 years we didn't include in the study. So material and methods, it was an observational study and study design was cross-sectional. So a self-developed paper-based survey was made, and 35 questions were there, and it was taken between December 4, 2020 to March 30, 2021. So this timeline was when there was lockdowns were going on, and post lockdown, then again lockdown, it was going like that. So questions related to demographics, behaviors, lifestyle, prevention, treatment, media's impact on the participant behavior during lockdown. You can recall the everybody was glued to the TV, getting the information of the COVID and what is happening around, है ना? Everybody was interested in that at that time. So because it was pandemic was going there, so community based survey was not feasible for us. So what we did, and we surveyed to the participants, the patients who were coming to our OPD at that time, and we gave them the survey, and they those who wanted to fill it by themselves, we gave them sanitizer before filling and after filling, and those who didn't want to touch the paper, we did that part for them. We could read the questions to them and they used to answer it. So survey form included a brief description on the background, objectives, procedures, their consent, and that their information will not be given to anybody. And this questionnaire was divided into 5 parts, evaluating the impact of lockdown and media on participants' behavior, habits, and lifestyle. And the other perspectives were perspectives on prevention were compared against demographic variables including age, gender, suburb of residence. So study setting was in our OPD of Homeopathic Medical College, Chandigarh, and population was 100, and study duration was between December 4, 2020 to March 30, 2021. Data collection tool was paper-based questionnaire and radar software. Study sample, it was non-randomized, and sampling technique was convenient sampling technique. So there were 32 questions in total, and we divided those questions in category. First was demographic, second was behavior related questions, third was lifestyle related questions, lifestyle changes, media impact, and prevention related questions. So demographic में there was age, gender, and residence. Behavior related questions में there were whether they developed any kind of fear, where there was fear of contracting COVID infection, fear of contracting COVID infection in unlock period when there was no lockdown, behavioral and mood changes during lockdown and after, behavior changes in unlock phase. Then comes the their reaction. Reaction in anger post lockdown, feeling during lockdown, what were they feeling, and was there feeling of anger due to loss of job, and whether they were expressing themselves or not, were there any change in sleeping pattern, were any kind of new dreams were there, and what were the cravings they were feeling during lockdown. Lifestyle changes consist of following questions, like whether they were praying more during COVID period, or they were cleaning their house again and again, any new developed hobbies, appetite, what was the appetite during COVID, and was there any financial loss at that time, and suffer from any routine troubles. So as we were seeing more and more of media at that time, we wanted to see was there any media impact at that time or not. So a lot of WhatsApp questions were circulated at that time. So we wanted to see whether everybody believed in that information or not, and what kind of TV serials they saw, and whether they were interested in Indian economy or not, and why migrant workers on TV, by seeing them, whether it evoked any emotion in them or not, whether they were sympathetic to them, did they help any poor at that time, and they searched COVID cases in their vicinity, was it there or not. Then we put some questions related to preventions, like measure taken to prevent infection, symptoms during lockdown, symptoms during post lockdown, any medicine they took during COVID, and whether they took homeopathic medicine or not. So the results and conclusion may, participants who completed the survey questionnaire were 100, and the average range of age was 29.18 to 34.1 year. Actually 18 to 16 years actual range came out, and in that 56% participants were women, and 83% were residents of Tri-City. Tri-City here means Chandigarh, Mohali and Panchkula, because all these cities are very closely connected. 64% residents of Chandigarh participated in this survey, and overall response rate for all the question was 94%. So here are the questions. How did you fear of contacting COVID infection? This was the question, and it was the options were medium, very less, too much, and no fear. So you could see here there was medium and no fear, it was coming. So 1/3 of participants were having fear of COVID infections, maybe because of the occupation, having close contact with others, and Chandigarh reported proportionately higher infection rate than rest of the other states. Then comes the, which measures did you take to prevent yourself from getting infection? So in that we included whether they were wearing masks, they were washing their hands frequently, whether they were maintaining 6 feet distance or not, and whether they were taking all the precautions or they were not sure. So 85% said that yes, they are taking all the precautions which are given by the government of India. So we wanted to know whether any behavioral change was there during lockdown or not. So sadness, anger, anxiety, crying, happy, anger, sadness, anxiety, no behavior change indicated. So these options were given, and close to half of the participants showed no behavior change during lockdown. So this was quite surprising for us. We were expecting that there may be some behavior change, but close to half, like 44%, they said there were no behavior change, and because of that they thought lockdown was a positive step. And sadness was experienced by 24% of the participants, and anger in 10%, anxiety in 15%. Then comes, did you notice these behavior changes in unlock phase when there was no lockdown? Did they feel any change? They said no, after lockdown there was no behavior change in 79%. So we wanted to see whether there was any reaction in anger during the lockdown. So option we gave was suppressed, does not want to talk, throws thing, abusive, no specific reaction. So nearly 51% said they had suppressed feeling and they didn't want to talk in anger during lockdown. What was your reaction in anger post lockdown? Post lockdown, there was no reaction related to anger. Then comes the we wanted to know whether there was any symptoms they experienced, like mental exhaustion, anxiety, indifference, insecurity, any violent behavior, mental and anxiety, mental exhaustion, indifference, or there were no signs. Near to half of the participants showed no specific mental symptom during lockdown. This was also surprising that they were not feeling that much. Near half to the participants, they were like, there was no specific mental symptoms, because they accepted the fact that lockdown was very necessary step to curb the COVID infection. Then comes the, did you experience any of the following symptom during post lockdown? Same options were given, and close to half of the participants had no specified mental signs and symptoms post lockdown. So during the lockdown they didn't felt any major change in their mental sphere, and post lockdown also there was no specified mental sign or symptoms. So then we asked, did you develop any kind of fear? No, yes, nothing. 83% said there is no fear. So this supports question one also, because many they firmly believe that they will not get infection of COVID if they follow the proper instructions. Do you still are afraid of getting COVID infection in unlock phase? So when they were not having any fear in lockdown period, uh, nearly half of the participants said so there is no fear in unlock phase also. Do you always watch and believe in what is said in television showing regarding economy of India? So in that people said we do not watch TV regarding economy of India, but they do not, because they do not believe in it. So there may be due to people had contrary opinions against media. Then 12th question was there any feeling of anger when you heard that many people have lost their job due to COVID crisis? Were you angry but not vocal? No anger, mild anger, very angry, grief, or any feeling specified? Around one third of the participant felt angry, but they were not vocal about it. They felt the feeling, but they were not saying anything about it. Equally, one third felt no anger regarding this, and reason could be one third participants were sensitive and sympathetic, but were helpless, and at the same proportionate participants were indifferent toward others. So one third people were sympathetic, but they felt they are helpless, they cannot do anything in that situation, and one third of the participant were indifferent towards other. Did you suffer from any financial loss during COVID crisis? So more than half of the participants did not suffer for financial loss during COVID crisis. So in Tri-City, more than half of the participants did not suffer the financial loss. So what were your feelings during period of complete lockdown at home? Were you happy? Worry was there, sadness, grief, anger, or combination of all these, or there was no feeling specified? So more than one third participants were happy during the complete lockdown at home, and one third were worried being at home. So there was a one third participants, they were happy that we are at home and we don't have to go out to do the job, and one third were worried that we don't want to be at home right now, we love to go out and do our job. And otherwise, the almost same question in this point could be there where people had hectic schedule, otherwise whether they were unable to spend time with their families. So those people who were happy being at home, the reason could be they had so much stress at workplace and there was hectic schedule, so they love to spend time with their families. And people who were worried may be due to uncertainty related to job or business in future. Did you feel any change in sleeping pattern between March 2020 to September 2020? So sound sleep, getting sleep a bit late, light and interrupted sleep, total sleeplessness, or there was no change. So more than one third of the participant had sound sleep, maybe due to being happy at home, because in previous question we said one third of the participants said they were happy, and here also one third participants are saying they had a sound sleep. So we could relate with the previous question. One third of the people had trouble getting sleep bit late. These people may be the participants who had worry being at home. So in last question, one third participants were saying we are worried being at home. Na? And in the next question, they said maybe they were the people who said trouble getting sleep bit late. Then the next question came, uh, did you get any new dreams during March 2020 to September 2020? Yes, no dreams. So more than 90% said they had no new dreams. So we then asked, did you clean your house yourself during COVID lockdown? Yes, every day as per the requirement, alternate days. Was not worried, no specific reason. So the result was more than half of the participants used to clean their house every day, which shows their cautious behavior. It relates to the question number 2, where 85% participants were taking all necessary personal precautions for COVID infection. In question number 2, we asked now that are you taking necessary care for not getting COVID infection? So 85% said yes, we are taking. And here, more than half of the participants said yes, we are cleaning our house every day. That shows the cautious behavior of them. So 50% were cautious and were cleaning the house and the surroundings. So we asked, was this lockdown a positive step? So more than half participants believed that it was a positive step because they could understand the seriousness. How much sympathetic do you feel for others, especially migrant labor during period of lockdown? So in that, half of the participants felt sympathetic for others, especially the migrant laborers during lockdown. And this could be due to the images and videos in which they saw that they were going barefoot from their for their native places, and they were without any goods and food for so long, and it was so difficult to reach to their places in the lockdown period. So this was also related to question number 12, as out of this 50%, about 25 participants were angry also. Does seeing migrant workers on TV evoke any emotion in you? So nearly half of the participants felt sad after seeing migrant workers on TV. This also support question number 19. Did you help poor people in any way during COVID crisis? Sometimes options were sometimes didn't help any poor as per the need when asked by others, always, sometimes as per need when asked by others, yeah, no option. So one third participants helped poor people sometimes during COVID crisis. This also relates to the question number 19 above, as out of 50% participants who were sympathetic, one third participant helped poor people also. So next question came, were you able to express your feelings during COVID crisis? The one third participants said they expressed their feelings sometimes off and on. This could be due to the fact that they were thinking about COVID-19 crisis and expressed their feelings about it freely. Then comes the question that how many times they used to search the number of COVID cases in their vicinity. About 40% said that they used to search it daily. Then comes, did you believe in WhatsApp messages circulated in phone giving any information related to COVID disease and its prevention? And did you believe in it and did some act on it, or you just believed it and maybe you believed sometimes, sometimes not, and you were, yeah, you were not sure. 42% participants did not believe and act. According to WhatsApp messages giving information related to COVID disease and its prevention, the reason could be that WhatsApp was flooded with so many fake messages at that time that eventually people started ignoring it. It also related to cautious behavior. What kind of serials did you watch during COVID lockdown? So we asked this question whether you were interested in entertainment episodes or religious or debates, any business, or it was unsure. So more than half of the participants used to watch entertainment serials during that time, and they wanted to enjoy their time at home. And one third participants already stated that they were happy being at home, as stated in question number 15. So one third people have already said they were very happy, and here they wanted to watch the entertainment episodes only. So then comes the question, did you pray to God more during COVID crisis period? Were you worried, matlab, you were praying as per your routine, yeah, you started praying a little bit more or too much, or you did not pray? Close half to the half participants used to pray as per their routine. And it was a little astonishing for me because India, religious people or more, and but close to half of the participants said they prayed only as per their routine. They didn't increase it. Did you suffer from other routine trouble during COVID crisis? Headache, cough, fever, or any other complaint, constipation, or there was no ailment? About 80% of the participants had no significant health ailment during COVID crisis. So the people of the Tri-City, they reported that in this survey that 80% of the participants had no health survey. They were happy at their home and they were feeling more healthy. Then we asked, did you develop any new hobby? Cooking, music and dancing, gardening, drawing, है ना? Anything, learning new language, television, watching movies, anything specific, or there was no specific hobby developed. So you must be remembering at this question that there were a lot of recipes were circulated in the WhatsApp group, and everybody was posting whatever they were cooking special every day. So about 40% of the participants developed cooking as a new hobby during COVID lockdown period, and this could be due to reason that Indians love to indulge in eating different cuisines. So few people who couldn't resist their desire for eating outside started cooking food for themselves at home. So in India, mostly everybody love food, so they got the opportunity to try their hand in cooking. So 40%, about 40% of the participants developed cooking as a new hobby. Did you feel craving for dainties during COVID lockdown, like rich fried food, spicy, sweet, salty, alcohol, non-veg, sour, rich, and any combination of this? Nearly 22% of the participants felt craving for rich fried food, whereas 20% participants had desire for spicy food. 20% has no specific craving. This shows that natural craving of food were maintained in 60% of the participants in lockdown. Excuse me. So the next question came, how was your appetite during COVID crisis? It was decreased or increased, or there was no change? So more than half of the participants had increased appetite during the COVID crisis. The reason may be 50% of the participant had no financial loss as were reported in question number 13, and one third were happy according to the question number 14, and about 40% participants developed cooking as a new hobby. So no doubt that about 50% of participants enjoyed their stay at home. So then we asked the important question, tell us about the medicine you took during COVID crisis. We wanted to see whether the participants has taken our arsenic album or not. So only 31 participants took arsenic album, and Ayurvedic Kada was taken by 12. So near half to the participant took no medicine during COVID crisis. As in earlier question also, people felt good about their health when they were staying at home. And here also, near to half of the participants said they took no medicine during COVID crisis. And it also relates to the question number 21, where 80% of participants had no new ailment. So then we asked, did you take homeopathic preventive medicine for COVID infection? Yes, no, unsure. So more than half of the participants said they did not take any homeopathic preventive medicines. 41% participant took arsenic album as homeopathic preventive medicine for corona. It is again related to question number 21, where 41 participants said they took homeopathic preventive medicines for corona. So here what the major observation came out, that people were careful about corona epidemic, and they were following all the precautions which were given by government of India. So they thought we are taking care of ourselves, so there is no fear of getting coronavirus infection. So reason maybe they were thinking that following all the precautions were enough for not getting the infection, or they were doing it forcibly. It was mandatory to follow the instructions given by government of India. When the lockdown opened, people were already fearless. During lockdown, they were fearless about catching COVID infection. So when they came out with lesser precautions. Maybe this behavior led to the second wave of COVID-19 infection. Only 35% had fear of contracting coronavirus infection. 70% people believed it was a positive step. 58% watched entertainment channels. Now, around 40% said they relished fried and spicy food along with sound sleep. 46% said they developed cooking as a new hobby. 53% had no financial loss. Routine physical troubles were gone. And 38% didn't search for corona epidemic news. And 37% didn't believe anything which was showing on TV. So, from all these questions and from all the responses, we tried to convert these symptoms into rubric, and Murphy repertory was used at that time, and radar software was used to repertorize the prominent symptoms. So what we could conclude from this was that there was carefulness, there was fastidiousness, there was ailment from suppressed anger, people were sympathetic, they were frivolous, fried food desire, spicy food desire, and appetite increased. We took all these symptoms and after repertorization, CPR came to be the medicine which covered most of the symptoms except fried food desire. So here is the repertorization chart. In this, you can see Natramur and sepia. Both are covering 8 symptoms out of 9. But why we selected sepia at this time? Because sepia didn't cover the fried food desire. That was a physical journal symptom. Whereas in Natramur, this frivolous behavior, that is a mental symptom, that was not covered by Natramur. So covering all the mental symptoms were more important than covering the physical journal. So we thought that sepia could be the medicine which we can use as a preventive medicine for non-COVID persons. So it is important to mention here that Surat Municipal Corporation, if you could remember, they used CPR 200 as disinfectant instead of sodium hypochlorite in containment zone of Kosar area of Amroli. It came in the newspaper also. And sepia 200 has also been used by Indore Municipal Corporation too. News of this was published in Indian Express on June 19, 2020. So conclusion is that sepia, according to us, sepia could be used as a preventive medicine for corona infection based on mental and physical symptoms obtained through our survey. Though this observation needs more research, but maybe our research has opened a new door for further research in this field. So that's all from my side.
Yes. Thank you, Dr. Amandeep Kaur. A wonderful study, especially the questionnaire you developed, really marvelous. A lot of reflections and discussions might have involved in framing such questions, 32 questions. It's time for discussion. Those who would like to participate, please raise your hand. You're often hearing that there is no research studies in homeopathy, no proper studies in homeopathy, lamenting. At the same time, only minimum persons are attending this program. What does it indicate? Body is in fact just as a formality there, this lamenting, it is no discussion, no research is there. But anyway, nice presentation, congratulations. I think the sample is a bit affected or a major part in giving certain results, especially you can see 56% are ladies.
Yes.
Then it is more conducted in an urban area, not a rural area. Then again, the role of social media. These are very important, I think, because when it is affecting the 56% percent of the population the conducted is ladies, they are quite natural. They always like to be with their homely affairs, with their children, with their family matters. Then again, they are
Yes.
more interested in cooking. Then another thing is that in the, the, the economic situations is not affected
Yes, sir.
because it is in the rural area, not in the rural, but in urban
In
area.
urban area. Yes, sir.
That's another point. Then I think the loneliness or the fear just not created because we have good communication measures, including this IFPH. It was started in the 2020 September. At
Yes,
that
sir.
time. So
We,
through this platform, we did communicate to the world. Then moreover, another thing is that as medical professionals, we have no restrictions. We can travel anywhere. I did travel to my hospital regularly without any interruption, with ease because of no traffic cops are there. Very
yes.
convenient for us, very comfortable for us during that period. Then again, of course, our medicines that is more support. Then another interesting point is that around 41% persons took this arsenic alcohol. So
Yes.
naturally, normally, the penetration of the homeopathic medicine in the society is not that much, around 10% or 15%. But this time it is 41%. At the same time, another interesting or important fact is that 56% of persons are outside this rescue measures.
Yes, sir.
On what base they didn't took this medicine? That means they are not at all intelligent. They are just
Yes.
blindly believes something else. This wrong notion of this 6 feet. Recently, a testament given the American Parliament said that there is no scientificity in advising the patient to keep 6 feet apart. Then this it only says about through this spreading through this air transmission, but no formate contamination is there. But even when handling these dead bodies, it will not cough, it will not sneeze. They always use this PP kit for what? Nobody knows. Then again, they
Yes.
use the sanitizer. You clip this way, that way. All observe, all practice. But now says that it has no logical, no scientific basis. So what is more important is that people like just tracing this or cruising behind this Pied Piper. They are just
Definitely,
going
sir.
ahead. That's another observation. Then again, the last point, I have a certain difference opinion regarding the last conclusion, the preventive medicine. Why? Why we should we select arsenic alcohol? Because
Sir,
essentially the process of this preventive medicine is essentially proving, kind of proving. So when you give these heroic medicines, as mentioned by Hahnemann, that will definitely prove symptoms more and more persons.
yes, sir.
At the same time, if you prove the medicine that are not at all vigorous in action, may not produce some symptoms, some mild symptoms. What happens in two similar diseases meet together? If you want to create such a situation, you must produce certain powerful symptoms or the patient who is seeking this prevention. That is why somebody advised this sepia, they did perished. One famous person, I not like to mention his name. Very unfortunate that happened. So what is more needed is a comprehensive study on the homeopathy philosophy is needed.
Yes, sir.
Why this is selected? It again, we found in Kerala, it is found that 91% was effective. The sample was more than 1 lakh. 1,15,000 was the study conducted by Government of Kerala Homeopathy Department. And the report was sent to the government of the Honorable Minister, the government. 91% was the effectiveness.
Wow.
Then we know that what happened to this vaccination drive.
Yes, sir.
Now, the myocarditis, the sudden deaths.
Sudden heart attacks are coming in young adults, sir.
Yes, yes.
The female organs are getting affected after these vaccinations also. So infertility and the discharge from the breast, these things are very commonly seen these days now.
The Hanimanian comment still worthful because he mentioned they pretend to console themselves. All possible has been done in case of deceased. But you are remembering that. Because since you are doing the PhD in hormonal medicine, am I right?
Yes, sir.
Even though it was written 200 years ago, still it is worthful.
Bilkul, sir.
The patient and the relatives pretend to console themselves. All humanly possible has been done in case of deceased. That the same thing happened even after 200 years when the COVID came.
Bilkul, sir.
If anybody is there, please comment. You can make. Our Ram Pravesh Shah sir is there. He is always ready to make comments. Sir, please. With a strong voice. Sir, please. Yes.
Thank you, Dr. Amandeep Kaur, madam. Very nice presentation. Excellent
Thank you, sir.
presentation of COVID-19. Very prevention of medicine, CPR, other cause of effect. Very thanks. Very thanks. Thank you.
Thank you so much, sir.
Then another important you said about this, the peoples, they are usually religious. But I think Indians are not that much religious.
Okay.
They has got their own ability to accept it. The fate, they are accepted.
Yes.
If it go according to his will, his desire. That is why the people are not at all panicking here. At the same time, what happened in Europe? They are really upset by this epidemic.
Yes, sir.
What was the mortality rate in Italy? Around 30%. But what happened in Dharavi? It is below 1%. Then in case of this UK, around 18%, Belgium 15%. That much people suffered.
Yes.
We claim they are developed countries. But who is a developed country? Mentally and physically developed nation, definitely.
Yes.
That's another important thing. Then again, 41% of people accepted or took this as
Positives.
album. At the same time, only 12 took Ayurvedic medicines. But what about the government share of this National Ayush Mission? The majority of share goes to whom?
Ayurveda.
Yes, that's a great tragedy. So you have done a commendable job. It's very much appreciated. I think the whole homeopathy fraternity is indebted to you for conducting this study.
Thank you, sir. Thank you so much.
Again, this must be presented or discussed in each and every institution or India. More than 200 colleges are there. Now 25 representatives are here. We have to study it more. It's a nice presentation of congratulations.
Thank you so much, sir.
Then 35% of people have no fear in contracting this epidemic.
Yes, sir.
Because they don't even care what it is. That's another thing. Now, Dr. Neha, you can have some comments. Yes. I think you are there. Yes, please.
Yes, ma'am. Sorry, I'm here very much. Very, deeply researched topic on COVID and its implication on the mental health and other behavioral issues on different types of people. And obviously, the time was a tough one for everyone. and everyone went through variation of emotions. When people went through variation of emotion, because some people went through a lot of there were a lot of deaths also happening, and it deeply affected them very much on every aspect of life. And even the after effects are being seen till now, that people
Yes.
are many people are so much afraid of the pandemic. And even I in my family also, I witnessed people having OCDs during the pandemic time, because there was so much obsession about cleaning the things, and cleaning the surfaces and sanitizing themselves and protecting themselves, that there was a clear indication of OCDs in many people. And the level of anxiety about losing someone they love, and even losing their own life, was very much evident there. So this is a thing we need to take care of in future also, as homeopaths, because homeopathy can deal very much on a very well level on the mental levels, and also on the implications of the physical symptoms arising out of the mental symptoms. So it was a very great insightful session from Dr. Amandeep Kaur.
Thank you.
Yeah, so
And I
that's
think
what I want to say.
the most suffered people are medical fellows.
Yes, sir.
CBD. Yes,
Yes,
in the medical colleges, they are really afraid of
Yeah.
this disease.
Yeah,
They-
because it was a toll that took a toll on the medical people also. It was a very tough time for them also. It was
the Indian Medical
tougher for
Association
them. Yes.
president who died at the age of 62. I not
Yes.
remember his time. Some persons in North
Yeah.
India, that at the age of 62, even though he treated scientifically. At the same time, why we must understand why we are capable of selecting a medicine to a newer disease.
Yeah, yeah.
Because of the clause provided by Hahnemann 26. The manifestation is similar but different in kind.
Yeah, yeah.
That is why homeopathy is successful even after 200 years.
Yes, yes.
Yes, sir.
It will be there. It will be successful because of different in kind. It will not affect. We don't need to make some new medicines from this coronavirus. As somebody this experimented. There is no need.
Yes.
We don't need to triturate this paracetamol, this allopathic medicines, because our medicines different in kind.
Yes, sir.
That is a specialty. If anybody would like to participate, please raise your hand. Hariharan sir, are you there? The regular participant, always making his own views and comments. Hariharan sir, are you there? That is an advantage of this offline, this online sessions. You can because as this moderator and host, we can see very interesting views on the camera. Somebody is not even aware of this, that this camera is open.
Camera is on.
Businesses, and we can see different views, different voices. We will suddenly mute them. That is an interesting thing. Anyway, this is a long session of 1,265 days completed, 67 is on. Then, Doctor, what about the prospects of homeopathy in Punjab, Dr. Amandeep Kaur, as of now?
Yes, sir. Sir, people here, they are very keen to take homeopathic medicines, especially I've seen in Ludhiana city. So there are so many homeopaths and all are busy in their practice, and people really want to take medicine in Punjab. And they say that we don't want to have the side effects of allopathic medicines, and that's why we are coming to your you will give us the medicine. We are going to give you a lot of time of our lives, but we want to get cured and we trust you. This is the main scenario coming over here. So it is a good scope in Punjab.
I think another important thing is that during this COVID epidemic, a lot of non-medical fellows came forward to support homeopathy. In fact, this IFPH is an evidence of such a stand. This was formed by an engineer, not a medical man. For that purpose, he brought all these fellows together to make this platform. And that is going even after 3.5 years. So that is an important factor in the IFPH. We must remember that Hahnemann at on stage of his life started to write articles in non-medical journals. So
the awareness about homeopathy has very much increased in the last decade.
Yes.
In the last decade, it has very much increased, and what I think we are about to witness the golden period of homeopathy, because now the world is starting to recognize us. The modern medical fraternity is also starting to recognize us, and that is, we are very fortunate to witness this event in our lifetimes, which Dr. Hahnemann himself could not witness. So there lies a lot of responsibility on our shoulders that we carry this legacy forward with very much responsibility, and by keeping the philosophy alive also, and using the correct pathway.
Yes.
To cure the patients.
It did provided a galaxy of opportunities for us.
Yes, it has.
Then we were connected together. In fact,
who would imagine, in the past 20, in the past 20 or 30 years that we will be organizing such webinars, and we will be discussing the incurable diseases on this forum.
Yes.
And that is a very, very good thing for homeopathy, I guess.
This 1,250 into 2 or 3 videos are there on YouTube on homeopathy. That's a major work, commendable work, and we must thank to our Dr. Hubert Silva to always uploading all these things.
Yes. Many people are working very silently, but their work will never go unnoticed. They are the main people who are working behind. So they are the main people.
Yes.
Not only the ones who are in the front, though also one who are working behind tirelessly.
Okay. I think time to conclude the session. May invite our Ram Pravesh Shah to express sort of thanks. Please unmute, sir. Yes.
Thank you, Dr. AMANDEEP Kaur. Very nice.
Please unmute. Please unmute.
During COVID-19 preventive medicine, CPR, OSD, Dr. Neha Kaur. CPR is a very important remedy, OSD.
Thank you, sir. Thank you.
Thank you. On behalf of IFPH month, every again presentation, very, very thanks.
Thank you, sir.
Anyway, you must publish, if possible, in certain newspapers, in the national dailies. Definitely, that will be a boon to this medical fraternity. Moreover, I just suggested that the position or the possibility homeopathy opened. The 31 people took arsenic album, 12 took Ayurveda. So there what about the expense of this medicine, the quantity of medicine? That is the greatest advantage. It's very easy to transport the medicine, to store the medicine, to administer medicine. There's no problem. No side effects, no untoward reactions. Then regarding the quality of medicines, the proved medicine, the scientific medicine. So we must capitalize on that. Then for that purpose, we must find out certain entrepreneurs in homeopathy. And IFPH started on entrepreneurship certain discussions. The last day we have a Malayalam session on entrepreneurship. Then only we will make more compatible, and we can provide funds for these research activities. With that remarks, let me conclude today's English edition. Hope you that we will meet the same time tomorrow. Bye. And Dr. Maria.
Why.